Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Dr. Gary Blau is the Chief of the Child and Family Branch of the Center for Mental Health Services of the Substance Abuse and Mental Health Administration, U.S. Department of Health and Human Services, and is on island for a federal site visit. He joins me now in studio. Hi, Dr. Blau.
Hi.
So tell us a little bit more about where you're from.
Well, I'm from the Washington, D.C. area, and I'm here with two of my colleagues, and we are out here to do site visits with Project Cariño and Ifamagunta, both of which have been funded by the Substance Abuse and Mental Health Services Administration, which is a federal agency, as you said, part of the Department of Health and Human Services, and we've been providing funds for them to have services for children who have serious mental health challenges. And both of these grants are continuing to work here on the island of Guam to help those children and families.
Okay, so what is this federal site visit really about? Is this like the criteria for them to be able to apply, or?
Well, no, they're already receiving money, and we're out here to sort of check on the money, to see what kinds of services that they're providing, sort of a monitoring visit, as well as to assist and do what we can to provide technical support for the grantees in any way that we can. So we talk about ways that they can help children, helping them to market their services so that the people on the island of Guam know that they're available and here to help. So we want people to be aware that Project Cariño, which is a grant that serves children that are birthed to 5 years old, and Project Ifamagunta, that serves sort of the older children, that if families have problems, that they can call and get help.
Okay. Now, you've been here, this is your third time here.
Yes.
And so you've been here and you've been monitoring these programs. So how do you think Guam is doing with its system of care grants? What are the challenges?
I think, like any grantee that we have, and we give grants all over the country. SAMHSA is an agency that tries to, to give money, to help people. And so, as in anywhere, there are both, strengths, and there are areas that we want to improve. What I can say about the staff and the support here on the island is that people are incredibly dedicated. They care a lot about the children and families that live here, and they want to do everything they can to help them, especially when they're in trouble, or they're hurting or suffering, from mental health problems. And the truth is that that a lot of people across the country have mental health problems. We know, for example, that about 20% of children at any given time will have a mental health kind of a challenge. They may feel anxious or depressed. They may, sort of have difficulties behaving or problems concentrating at school, and these programs will help them to improve their functioning and do better. So from our perspective, the people that are working in the programs and all the supports that they get have been doing a great job and are working really hard to help families. And at the same time, there are always areas that they can do more. They could, try to get more staff and try to do more outreach so that more people on the island know about their services and know how to access them when they need them.
Oh, okay. Now, what is the importance of sustaining these services for children, their families, and for our youth?
Well, the federal grants only last for a certain amount of time. So in the case of Project Cariño, the one that serves younger children, they really only have another year or so on that project before the federal funding runs out. And currently the Ifamagunta grantee has only several more years, but eventually the federal money goes away. So what we try to do is to help folks to find ways to get more resources and to keep the good services in place. What we do with these programs is that when somebody has a problem, they try to wrap around services. So all the different kinds of ways, whether it's therapy or family support or working with coaches or schools and teachers, everybody working together to make a difference here. And we'd like to see those kinds of things continue. Now, the good thing about the island is that there are a lot of champions for children. So we work really closely, to find those champions. I know, for example, we've been meeting with the governor's office representatives and the leadership of the agencies, like from the Department of Public Health and Social Services and the Department of Behavioral Health, and all the leadership, legislators like Senator Yamashita and Senator Rodriguez that care so much about children. And of course, the leadership at the governor's office that tries really hard to ensure that the resources are in place. So our goal is to help the programs do their job of taking care of kids and as we say, caring for every child's mental health.
Well, thank you so much, Dr. Blau, and we hope you enjoy your visit. And thank you so much for watching. Remember to stay healthy, Guam.
Captioning